this is humerus, a bone of the upper limb, right? And before we study its side determination, we need to know a few things. That this pink thing is the head of the humerus. This smaller protrusion is known as, or the elevated portion is known as, the lesser tuberosity, and this laterally present tuberosity is known as the greater tuberosity. And in the lower part of the bone, these are the this pulley-like thing is known as trochlea, and this is known as capitulum. So they are always towards the lower part of the bone. So what are the points of the side determination? That upper part of the bone is being made by the head, the two tuberosities, and the lower part of the bone is being made by the trochlea and capitulum. Then there is another point that the head, this is the head, it always points towards the medial aspect of the bone because it articulates with the scapula. So it always points toward the medial aspect of the body. Then this lesser tuberosity is always anteriorly present, and this greater tuberosity is laterally present. And for these, the trochlea and capitulum, they are towards the lower side of the bone. So we determined that this bone is of the left side of the body. Now, as we studied that in the upper part of the bone, there is head, this pink thing. This pink thing is the head. Apart from head, there is this small tuberosity, which is known as the lesser tuberosity, and we have a greater tuberosity. Where is the greater tuberosity? This pink thing here is the greater tuberosity. Then between the two tuberosities, we have a bicipital groove. This is the one which is shown with the purple color. This is known as the bicipital groove. In the bicipital groove, there are two lips. The lip which is present towards the lateral side of the body is known as the lateral lip, and the one which is present towards the medial side of the body is known as the medial lip. And the floor and this thing which is at the bottom is known as the floor of the bicipital groove, right? Then we have three necks. There is an anatomical neck, there is a surgical neck, and there is a morphological neck. Where is the anatomical neck? This yellow thing is the anatomical neck, which separates the this thing from the rest of the bone. This is the anatomical neck. Then we have a surgical neck. This surgical neck is here. It separates the head of the humerus from the shaft of the humerus. And the morphological neck, it is not visible on the bone. It is present within the bone, so we cannot really see it. So where is this anatomical neck? This is the anatomical neck, this yellow boundary. Where is the surgical neck? If you have to draw it, it would be somewhere here. Somewhere here. It separates the head of the bone from the shaft of the bone. Right? So we already know that the lower part of the bone is being made by the trochlea and capitulum. This pink thing is the trochlea. It is a pulley-like structure, and this big thing is the capitulum. Above trochlea and capitulum, we have fossas. This fossa, and there's this fossa, pink in the yellow one. The yellow one above the trochlea, this one is known as the coronoid fossa, and the one which is above the capitulum, it is known as the radial fossa. So here we have the capitulum, here we have the radial. And if you turn the bone over, so there is another fossa, the pink one. This is known as the olecranon fossa, right? Then we have condyles. The condyle, this thing towards the medial side of the body is the medial condyle, and the one which is towards the lateral side of the body is known as the lateral condyle. Now above the condyle, if you trace down to this thing is known as the lateral supracondylar line. Okay? And if you trace down from the medial side, so this thing is the medial supracondylar line. This is the medial condyle, and this line is the medial supracondylar line. And on the lateral aspect, we have the lateral supracondylar line, right? We have three borders of the bone. This border, the yellow one, is known as the anterior border. it starts from the lateral lip of the bicipital groove. This purple is the bicipital groove, and it starts from the lateral lip of the bicipital groove and it extends downwards, and its lower course it becomes rounded and it's very hard to trace it down. So the medial border, it starts from the medial lip of the bicipital groove. This pink border, this is the medial border. It starts from the medial lip of the bicipital groove, and in its lower part it becomes very prominent as the medial supracondylar line. This thing, wait, let me point this thing, the medial supracondylar line. In its lower course it becomes really prominent as the medial supracondylar line. Similar is the case with the lateral border. It is difficult to trace it down in the upper part of the bone. It's rounded there, you cannot trace it down, but in the lower part of the bone it is quite traceable as the lateral supracondylar line. Right, so we have three borders: the anterior border, the lateral border, and this pink one, the medial border.